Everyone. Hope the meeting is going well. Just wanted to take this opportunity to send a great big thank you to AACE on behalf of myself, Breanne Lott, and my READS Grant partners, Binyam Tefera and Purnima Madhivanan. We led a project on breast cancer patient and survivor support in Ethiopia. Just wanted to tell you a little bit about the project and how it's been going. Ethiopia is a country with almost non-existent services to support the mental well-being of cancer patients and survivors. And to this end, in 2020, Dr. Deresa started a first-of-its-kind psychosocial support group for breast cancer patients. Women come together about once per month to have an Ethiopian coffee ceremony and talk about their experiences. Through the READS Grant project, we wanted to be able to build the capacity of this support group and to leverage them for additional education and screening in the community. We also wanted to study the quality of life of the support group participants versus non-participants. So some of the things we were able to do with the grant are compensate the peer leader, invite in guest experts, and help them to gain visibility within the community. The meat of our project was the education and screening events that we hosted. So we started by creating culturally and linguistically responsive educational materials. We launched a great big mass media campaign and hosted community screening events. This is what some of our educational materials looked like in the local languages. We also translated an app so that women could conduct breast self-exams at home. These are cancer survivors passing out flyers in the community. And these are examples of interviews that our oncologist and peer leader were featured in on local and national radio and TV channels. The reach of this mass media campaign was in the tens of millions. And we used this as an opportunity to invite women to come in and actually get screened. So we ultimately were able to screen 525 women in 2 communities and diagnosed 1 early stage breast cancer. So we're so glad we were able to get her connected with care. We presented on this work at ICEC 2023 and have also written it up for a publication in Journal of Cancer Education. For the research aspect of our READS Grant project, we wanted to study the quality of life of the support group participants and non-participants. We conducted 4 focus group discussions and administered surveys to about 300 patients and survivors. We ultimately were able to describe some really important barriers to care, facilitators for engagement, dug into a little bit, the role of community and family and what that was like in seeking care for breast cancer, and then also described the importance of these social support groups, which improved the emotional well-being, treatment adherence, and overall quality of life for participants. Through our quantitative analysis, we found that those who were participating in the psychosocial support group had better overall health scores, especially in the areas of role and social functioning. They reported fewer symptoms like fatigue, nausea, vomiting, and appetite loss, and had improved sexual enjoyment compared to those who didn't participate in the support group. And outcomes of this research part of the project include 1 manuscript submitted and under review, another in progress, 2 small grant applications to Pfizer, and our biggest update that we have to share is that the 3 co-PIs on this project also had another grant recently get funded by NIH. So although the topic's a little bit different, cervical cancer screening instead of breast cancer care, we really credit the READS Grant project as giving us an opportunity to build our partnership and our cancer equity work in Ethiopia. So we just want to thank AACE one more time. Anyone's free to reach out to me if you have any questions, but thank you.